Hello, everyone. Welcome back to another day with your fertility specialist. I'm your host, Joanna Damina, for today. Thank you for joining us. We always appreciate your presence here, and we love to tell you something new every time we come on this live. Thank you for your continued support. Every click, every like, every share. We really appreciate. And on that note, I would like to encourage you to share this with someone you think would be interested in learning more. Today is a testimony Friday. That's a testimonial Friday. So we're going to talk about someone who has had a successful fertility journey with us, right? And there might be someone out there that you know that has had, unsuccessful fertility treatments, or they've just been struggling with their fertility journey. Share this with them. Stay tuned. We're going to talk about a lot more than just this one person's story. We're going to be learning new things about how the fertility journey might go. Everybody's process is different, right? So whenever we have these testimonials, we try to, talk about everybody's different procedures so that you know that you're not alone out there, and we're here for you. Today we have Dr. Deborah Olivier with us. Thank you for joining us.
Thank you, Joanna. It's always a
Yeah,
pleasure to be here.
it's
Good day,
always.
viewers. Please keep listening, keep sharing our videos, keep liking, and keep informing others. There are lots of people out there that needs, to hear the
Mhm.
things you're hearing on this channel. Thank you so much for always joining us.
Yeah, thank you so much. In case you did not know, Dr. Deborah is a family physician. She's also a consultant gynecologist and an IVF specialist, especially the IVF coordinator here at Alps Hospital. So you know that every good news about this fertility journey comes directly to Dr. Debbie. So she'll have a lot to, tell us today. And like I said, this is also to encourage you that you're not alone out there, and don't give up on your fertility journey, because there's a lot more out there for you to try. We're going to talk about something new today. When I was reading this, actually, I found, something new to
Okay.
talk about. So we're going to be, learning about some other ways that you can improve your chances whenever you start a fertility treatment. So, Dr. Deb, we're going to talk about Amara's journey,
All
right?
right.
She
Okay.
first started as, my name is Amara, and my road to motherhood wasn't easy. I mean, nobody's road to motherhood is, how would I say, roses and petals. You
Yeah.
might have an easier time with conception, but
Yeah.
motherhood itself is, it's a, how would I say, commitment. It's something that you have to sacrifice for at some point or another.
Yeah.
So yeah, motherhood is not
Yeah.
a very
Everybody's
easy journey.
story, everybody's journey is different.
Hmm.
Some people have it more easy,
That's true.
but I'm happy with this, beginning. At least
Yeah.
this will encourage a lot of people that have not had it rosy and so easy,
Hmm.
that, like you mentioned, they're not alone. Yeah, I'm sure this, let's go on,
Yeah, let's
this
go
will
on.
encourage them. Yeah.
So she said her husband and her had been trying to conceive for almost 7 years. You
Mm,
can imagine,
yeah.
for 7 years. And we know what that means
Mm.
in our part of the world,
World,
right? Like,
yeah.
even from your wedding day, you
People
have
are
relatives
counting,
say in 9 months'
9 months
time.
exactly. We're
So,
coming for
it
naming
can be,
ceremony. Yeah,
yeah, it can
that's
be
true.
quite
We can be
difficult.
womb watchers in this part of the world. Yeah.
Exactly. So it can be really difficult to,
Mm.
have that patience to keep trying
Yeah.
for 7 years. I
It's
mean,
not an easy
is
journey.
that something that you see
Yeah,
often?
yeah, a lot. We see it a
Mm.
lot. And then, with our attitude, will I say, is it our cultural beliefs? Is it our environment also playing a part? People keep faithing
Mm-hmm.
and waiting and waiting. We've seen people 22 years, 16 years. People
Wow.
just keep waiting and waiting and waiting. Sometimes they don't even come to the hospital
Hmm.
to be evaluated, to even know what the problems or the issues are. They just keep believing and believing, and then the time is just going. And
Going
like we
on.
always say, a woman's clock is ticking. And
Sticking.
by the time they eventually present to the hospitals, they're just a myriad of issues to deal with.
Mm.
Yes.
So would you encourage them to, come a bit earlier into that
Definitely. We always
procedure?
counsel, if you're 35 years old or above,
Mm-hmm.
after trying for 6 months, you should see your fertility specialist to know why
Mm.
pregnancy is not happening. If you're younger than that, you can try for up to a year. So
Yeah.
we don't encourage endless waiting. No, we
Yeah.
don't encourage endless
I
waiting. Yeah.
mean, I know that you might want to wait to see, okay, yes, this time around it might happen. But
Yes.
then there's a reason why, there's always a reason why something isn't, happening, or something
Yeah, for
isn't going
most
right.
cases,
Yeah.
yes, there's
Most
always
of
a
the
reason.
time, yeah, there's a
Yes,
reason. So it
yes.
would be best for you to come in a bit earlier, because like with anything in life, the longer you wait, the more difficult it might be. And then,
Yeah.
yes, like Dr. Debbie said, there might be a myriad of,
Other
problems that we
issues
need
that will
to.
set in, because for example, let's look at the women folks. After waiting that long, sometimes by the time they come in for fertility treatment, they're in their 40s.
Hmm.
At that time, they no longer have eggs,
Well,
and then the issue of should I use donor eggs start coming. But if they come in
exactly.
much earlier, they would have been able, that those topics won't come in, those issues
Hmm.
won't have presented. They might have been able to use their eggs. So
Yeah.
we always advocate the earlier you come in, the better for you. Once you've known, you've tried for 6 months if you're above 35 years of age, or for about a year if you're younger than that, please always see your fertility specialist. To even see and be evaluated and be told, oh, we don't see a reason why you're not getting pregnant. Yeah,
Mm-hmm.
at least you know that there's no issues
Yeah.
that needs to be dealt with.
So at least
Yes.
you're more aware of what is going on, with your reproductive system. You know that
Yes.
if there's a reason, you can work towards it. If there's no reason, then you might have to, go about it in a different
Different
way.
way.
So
Exactly.
she said when they started IVF, which is, I mean, at the end of this 7 years of
Okay.
trying
All right.
naturally, and they couldn't
Yes.
conceive, they decided to start IVF. She was full of hope, right? And like she just thought that science would just, give her
Yeah.
a
Sometimes, yeah.
baby, right? So
Yeah.
I do see this a lot. Like people just think when you
Yeah,
come
people think
for,
that IVF is
mm,
100%. IVF always works. People have that wrong notion.
mm-hmm,
Yes, no. So IVF can fail for a variety of reasons. You know, IVF can fail for a variety of reasons. Some of these reasons could be related to embryo,
mm-hmm,
embryo-related factors, reasons related to the uterus.
mm-hmm.
So, for example, embryo-related factors, the quality of the eggs, the sperm that make up the embryos,
Yeah.
will determine the quality of the embryo. Is very important. With advanced age, egg quality is usually poor.
Mm-hmm,
And then even with advanced age in the men, though that doesn't set as early as that for women,
mm-hmm.
sperm quality is also poor. With advanced age, the sperms, the eggs have a lot of chromosomal abnormalities.
Wow.
So pregnancy happenings from embryos generated from those kind of gametes might be more difficult. And then other lifestyle issues,
Mm-hmm.
people that have uncontrolled high blood pressure, diabetes, abnormal thyroid function, thyroid hormones, all that could lead to pregnancy not happening, or even when
Mm-hmm.
pregnancy happens, could lead to miscarriages. Yes, factors in the uterus, people that women that have huge fibroids, or
Okay.
fibroids close to the lining or in the lining of the womb, which
Mm-hmm.
is where pregnancy happens.
Happens, yeah.
All that can prevent pregnancy from happening. And even when pregnancy happens, there's a high chance of them having miscarriages.
Mm.
Other factors in the uterus, like some congenital abnormalities. Some people have congenital abnormalities. That means abnormalities they were born with
Born with,
that
okay.
they didn't know, that could
Mm-hmm.
be predisposing to them not being able to spontaneously conceive. And if an IVF is done without those factors, those issues resolved, even an IVF will
Could
not
also
will not
fail.
will not succeed.
Okay.
Yeah, so a lot of issues lead to failure of an IVF. Yes.
So, like fertility treatment, IVF is not a one-stop shop that once you just go ahead to do that, once you start it, it's 100%
Yeah, and
that
that's
you're
why
going
you
to
should go to
succeed.
a facility where you are properly evaluated.
Yeah.
We see clients coming in and they say, I want to have an IVF. We said, okay, yes, you want to have an IVF, that's fine, but we need to evaluate you,
Mm-hmm.
because there might be other issues we need to address
Yeah.
before we even go into having the IVF treatment
Itself.
proper.
Yeah.
Yes.
So
So it's,
for
yes, so we must optimize the environment in your
mm,
to increase your chances
chances
of
of
the IVF.
okay.
Yes.
Yeah. So Amara says, she had the first cycle of IVF and it
Okay.
failed.
Okay.
She was told that okay, yes, it happens. Like we said, it's not 100%, it's not a
Exactly.
one-stop
Yeah.
shop.
Yeah.
And then she said, okay, let her try it again. And then she failed again the second time. And she had another cycle, which is 3 cycles now,
Wow.
and she failed at that.
Again.
Is it, I mean, are there any negatives to having repeated
Oh,
cycles
definitely.
of
Imagine
IVF?
someone going through repeated failures. It's not
Mm,
a very easy situation. Imagine the
yeah,
repeated frustration, emotional trauma,
exactly.
psychological trauma, hope being dashed
Mm-hmm.
with a failure,
Yeah.
repeated. It's not an easy situation to be in for any woman. This woman is already really traumatized. So any other thing, even when she's seeing someone else, she comes, her vision is already colored
Mm-hmm.
by all these failures she has had.
Yeah.
So it's usually very difficult for them to take whatever you are advising or counseling them about. So it's not an easy situation. It takes a lot for a woman to come out of repeated failure. So that's why we advocate proper evaluation in a good fertility center like Alps Hospital,
Mm-hmm.
where you're evaluated by specialists, all the necessary investigations are done, so that that first shot, it's a big one that there's a high chance of
Yeah.
that resulting to
I
success.
mean, yeah, Amaran says, okay, while when she had that, the last one or the third one, I should say, that
Yes.
was, she had a negative test result for her pregnancy, and she was demoralized about it, and she had family to discuss with and talk to, and then her sister-in-law
Okay.
suggested that she visits Alps hospitals
Okay.
here in Jos, and she's in Port Harcourt.
Oh man, yeah, we
So
have
you
clients from
see,
all over the world.
that's quite a
Yeah,
distance.
the world is a global village now.
Yeah.
We have clients from everywhere. We have
Mm-hmm.
clients from all over the world coming to our facility to access
Oh
care.
wow,
Yeah,
that's
and
quite
the way we
interesting.
work, we try to work within their schedule. We
Mm-hmm.
try to make it as seamless as possible for them. Yes, so there are lots of things we do to make the journey less stressful for
Okay.
our clients that are not domiciled in Jos.
Mm-hmm.
We have a facility in Abuja now.
Yeah.
Yes, so there are lots of things we do to make it
To make it
easier, the
easier
process
for
easier for
them.
them.
Because I'm like, Port Harcourt is quite a distance
It
from here,
is,
and then
it
you're even
is.
talking about from all over the world. I mean,
Mm.
that's quite a distance for people to come. So that's just to say that, like the fertility specialists in Alps hospitals have.
And a lot of these people are referrals from our clients that
Exactly.
have
So other
come here.
people that have done
Yeah,
this,
a
like she
lot
said,
of
her
them are
sister-in-law. I
referrals.
mean, I don't even
Exactly.
know exactly if she
Yes.
has had her
Yeah,
fertility
lots are
process done
referrals.
here,
Yes.
or she knew somebody else that did it, and
Yes.
it's just that goes to show that the fertility specialist here
We're doing a
at
lot of
Alps are
good
doing
work.
a lot of good work.
We are.
Exactly. To have
We are.
that as referral, that you should
Mm.
come in here and just see the doctor at the very least.
Yeah.
She said when she came in, she also had to go through those tests and
Definitely. That's
evaluations.
just
So,
the logical way to
yeah.
start.
So, what are some
Yes.
things that, because I know some people will be saying, oh, okay, they travel all the way to Jos. I mean,
Yes.
what are they going to do? You
Yeah,
know,
yeah, a lot of things are different because
mm,
the expertise of the people doing the things,
mm-hmm,
the way the samples are taken, the way they're interpreted, we can't really guarantee what happens anywhere else. We can
yeah,
only guarantee our own processes. That's why, well, for some of our clients, we even look at results from other places, but we
mm-hmm,
tell them we're working based on this results. We're not guaranteeing them, and we hope when you eventually come, this is what we find, what the results say we'll
yeah,
find. Yes,
yeah,
so there are lots of investigations we need to do. For a woman, one of the important ones is to do a transvaginal scan. A
okay,
scan to look at the uterus, to look at the ovaries, to look
mm-hmm,
at the endometrium, the lining. All these are important. I mentioned factors that could lead to an IVF failure.
yes, you
We
did,
look at the uterus to see if there are fibroids,
okay,
not just if there are fibroids, the number of the fibroids, the sizes, the
mm-hmm.
location. Yes, so if a woman has a submucous fibroid, this a submucous fibroid is a fibroid in the lining, the endometrium, and that's where implantation
Oh
in an
wow,
IVF treatment process, that's where the embryos are dropped.
mm,
So how do they implant when there's an abnormal structure there? So we look at all those on the scan, the
mm-hmm,
ovaries. We look at this woman. Does this woman even have eggs? There's something we call intrafollicular count, which
okay,
you look at. We look at abnormalities in the ovaries. Are there cysts?
mm-hmm,
And so on. So that's one. A lot of blood investigations are done too.
mm-hmm.
I mentioned we want to rule out any other medical condition,
Yes, mm-hmm,
diabetes, hypertension. So your sugar level is tested. We screen for a lot of infectious diseases. Then we do hormonal evaluations for the woman.
yeah.
Hormonal
Hormones
evaluation
are
is
quite
done, and a
important.
very important
Mm-hmm.
test, AMH, anti-malarial hormone, is also evaluated. That gives us a guide to the ovarian reserve. How much egg does this woman actually
Oh,
have? Yes,
mm-hmm.
guide, and a lot of other tests. The thyroid function hormone is tested. The seminal fluid analysis is done, and then these are just the baseline.
Mm-hmm.
From this, when we get this, some further tests could be
Can
done.
be carried
Yes,
out. Okay,
yes. So all
okay.
this will guide us to counsel these clients appropriately. I
Mm-hmm.
know they'll guide the kind of treatments we might need to do even before having an IVF. A lot of clients might need to do some other intervention, have some other interventions or even procedures
Yeah, just to
before.
make that sure that
Yes,
you have, like a
you optimize
prime.
a
Yeah,
good, you
exactly.
optimize the environment for
Mm-hmm. For
IVF to
conception.
succeed.
Yeah,
Yes.
that's true. She said, like she went through those tests and
Okay.
scans and evaluations in Alps Hospital, and then she had a procedure suggested to her that she'd never heard before, right?
Okay.
Which is something new that I was talking about. She said her doctor suggested a diagnostic hysteroscopy.
Okay, good.
Now, I would really like to know, and I'm sure our viewers too would like to know what a diagnostic hysteroscopy
Hysteroscopy
is. I
is
mean, it
okay.
sounds quite foreign, right?
All right. So hysteroscopy is just a procedure to further look at the lining of the womb or the endometrium,
Okay.
which I mentioned is where the embryos are dropped for implantation and pregnancy to result. So that part of the womb is very, very crucial and it needs to be in a healthy condition. Yes, a scan can evaluate it to an extent, but hysteroscopy goes further because with hysteroscopy, a small telescope is passed through the vagina. The woman is not cut open.
Okay.
And then this telescope goes into the womb, into the lining of the womb, and then the doctor can visually look into the lining of the womb so that you can
Wow.
visualize any pathologies in there. Pathologies like scar tissue, you see fibrous tissue,
Okay.
adhesions, even polyps, those are abnormal growths in the lining, even fibroid, submucous
So those
fibroid.
fibroids you were
Yes,
talking about, that can be
exactly.
seen in a
That can be seen,
hysteroscopy.
yes. So
Okay.
hysteroscopy is not just important for IVF. Yeah, hysteroscopy is used to diagnose a lot of other conditions too.
Okay.
A woman having abnormal vaginal bleeding, a woman having a thickened endometrium, for whose cause you don't know. Even when IUCD is a form of contraception. When it goes missing, when it's not no more situated where it was placed, and it has moved up into the womb. So hysteroscopy can be used to locate it and
Okay.
even to remove it. So hysteroscopy is not just diagnostic. You know, in our center, after you do your diagnosis, you can also treat. So it can be therapeutic.
Okay.
At the same sitting, whatever pathologies you notice in the endometrium can be treated
Okay.
at that same
So
sitting.
things like those
Like those fibroids
the
in the lining
tissues
can be
you were talking
removed,
about.
polyps can be removed, the adhesions, fibrous tissue can be removed. Yes.
So I believe Amara actually had those as well.
yes.
You know, she was talking about during the procedure, they discovered that she had those scar tissue,
Okay.
endometrial polyps that were probably,
can
you know, those
imagine.
things can prevent the
Yes,
implantation of
definitely.
embryos,
They
right?
definitely can
So,
prevent it.
does hysteroscopy, can we say that hysteroscopy can increase your how would I say chances of successful IVF
Definitely,
cycle?
yes. Even hysteroscopy, well, one of the things we do for someone that's even had repeated IVF failures is hysteroscopy. Yes, you know, when you've ruled out causes of failure related to the embryos.
Yeah.
Another thing, crucial area you want to look at is the lining of the womb. So it's just a normal logical flow of things for you to want to
Okay.
do a hysteroscopy to just reassure you that that lining is fine.
Okay.
Yes, there mustn't be an abnormality there, but looking at it, like she said, a diagnostic one, and you see that nothing is wrong, that reassures you that, oh, this lining is fine.
Okay.
So wherever the failure is coming from, this is not where failure is coming from. Then you can focus your light on other areas that you think the failure could be coming from. Yes.
That's true.
Combination of factors, it could become from one the endometrium being the cause of the failure. Then you look at other things. Yes.
Okay.
Yes.
Because I also believe that, like she said, she had those endometrial polyps and
Okay.
scar
She
tissues.
had
Yeah.
adhesions.
I mean,
yes.
I'm sure it could be, should I say, a bittersweet moment? I don't know if it's a relief or a bittersweet moment. I mean, I'm guessing it would be a relief to know that there was a reason
Finally,
behind,
exactly.
you know, those failed
failures, the three failures
cycles.
she had. Yes.
But it could also be bittersweet because
It
you
was not-
you now know
wasn't
that
detected
exactly
earlier.
it wasn't detected earlier, and then you know that this is something that can be both diagnosed and treated in the same sitting. Because she said her doctor performed a laser hysteroscopy. We've
Okay.
already heard that hysteroscopy, I mean, is a new thing, right? Let me not say new, but I mean, most people may not know what a hysteroscopy is. Like Amara did not know what it was, and then we're now going into laser hysteroscopy. I mean, what exactly does the laser hysteroscopy do? I mean, is it something that makes it easier to treat those
Yes, so
abnormalities that you may
that's the
find?
method used to remove those abnormalities. So later it's just a form of light therapy
Okay.
that is used to remove those abnormal tissues. So it makes it more seamless than you having to cut with scissors or using instruments to cut. Yes.
Oh, okay.
Yes.
That's really interesting because I mean, when I hear of laser, I'm quite a skincare enthusiast.
Yeah, so there are a lot
Laser
of
hair removal and
It's
laser
the same
facials and
technology.
things like that.
The
Okay.
same technology,
And that's
yes.
that's safe being used on the inside of a woman, inside the
Yes, it's
uterus
safe.
of a
Yes,
woman.
it's controlled, monitored.
Okay,
Yes,
that's really interesting.
yes.
So a hysteroscopy, is it would I say, is it major procedure? I mean, you mentioned earlier that the woman wouldn't have to be
Yes, she doesn't have a cut on
cut or
abdomen.
anything.
So we do it
So,
as a day procedure.
hmm.
Hysteroscopy takes a few minutes
Hmm.
and the woman can go home that same day.
Oh, okay.
Yes,
Oh,
she's not
wow.
admitted in the hospital at
Yeah.
all. Yes.
Okay. So hysteroscopy is nothing to be worried about then. I
Yeah.
mean, like we said,
When it's done by
your
experts,
okay,
yes, there's
true.
nothing to worry
Yeah, it
about.
shouldn't be worried. I'm
Mm.
talking from the point of view of house hospitals because I trust the professionals here. But I guess that just means that there needs to be more intensive, or should I say extensive, evaluations and testing when a person comes in for IVF cycles or
Ex-
fertility treatments,
yes.
especially when they've had failures before.
Exactly, multiple failures. Yes, there must be more extensive, evaluation. You must be doing something different. You
Mm-hmm.
can't be doing the same thing and expect to get a different
Different,
result.
yeah.
Yes,
I mean,
yes. So you definitely need to evaluate this
yeah.
client thoroughly.
I believe
Yes.
it was Einstein that said, like doing the same thing repeatedly but expecting a different result is insanity, you know. She also mentioned like after her hysteroscopy, she had to, recover for
Yes.
a little while before coming back to start the IVF cycle. Hysteroscopy is, I would, from what you've said, I would gather that it is within the line of the journey, right? But it's
Yes.
not the main thing. It's just something that optimizes, should I say, the uterus
Yes.
for
Yes. So
the IVF
IVF.
itself. So
Yes.
how long after hysteroscopy can you, or would you counsel your clients to come back for the
And the
beginning of,
IVF.
yeah, the
Okay,
IVF
so it
cycle?
depends on what was found at hysteroscopy.
Okay.
So there are lots of clients that do hysteroscopy and everything looks fine.
Hmm.
Those clients can just, proceed to have their IVF treatment
Oh,
immediately.
wow.
But someone that had some surgery done, maybe
Mm-hmm.
someone that had fibroid removed, polyps removed, or evolutions divided, depending on
Hmm.
the extent, might have to take drugs to enable healing for some time.
Mm-hmm.
Yeah, so for a lot of clients, some proceed immediately to IVF.
Okay.
Some might have to wait for a month, take some
Mm-hmm.
drugs for a month. Some might even have to take for 2 months. Some might even have to have a second look hysteroscopy.
Oh, okay.
Yes, because depending on the extent of the abnormalities seen, everything might not, one hysteroscopy might not be able to come, to take care of everything. So we might
Mm-hmm.
need to do a second look to make sure everything is fine. Now, if there are still some residual issues, those are dealt with at the second look. So
Okay.
everybody's journey is different.
So,
It depends on what is found
mm,
at
so I
hysteroscopy.
mean, if someone has a second look hysteroscopy,
Yes.
usually, let me ask again about, like time frames. I mean, when would you, after the first hysteroscopy, like when
Yes.
would you recommend to have a second one?
Second
Because I
look.
mean, regardless of how safe when performed by a professional,
Yeah.
it is, I'm sure at some point, the body needs to recover. There's a foreign thing being
Well,
done.
hysteroscopy is a minimally invasive surgery, so it's
Mm.
not really, like
It's
I
not
said,
like,
we do it as day cases, so
yeah.
it's yeah. So the trauma to the body and all is very minimal.
Okay.
Yes, but it depends on what was done. If
Mm-hmm.
you had to have some mucous fibers removed, intracavitary fibers removed, or polyps, or you had a lot of intrauterine adhesions that you had to divide and remove,
Mm.
yeah, that kind of clients, you give drugs to enhance healing,
Okay.
build up normal endometrial build up healing, and
Mm-hmm.
so you want those drugs to work for some time. So
Okay.
in those kind of
Yeah.
clients, we might say come back after a month,
Mm.
or come back after taking the drugs for 2 months to
Mm.
continue the IVF. And depending on the extent of what you did, the operative hysteroscopy now that you did, or
Mm-hmm.
whatever you did, you might want to tell the client that I want to go back and check that everything is fine.
Mm.
And if there are still some residual abnormalities, so at that second look,
You
that
can
can be corrected. So
still.
even from a second look, it depends on what was found that will
Mm.
determine when the client will come
Oh, okay.
to continue
Okay,
to
that's
have their
interesting.
IVF
That is
treatment.
I mean, I'm talking about it because, when people hear of certain procedures, they might
Yeah,
get worried
worry
about the
definitely.
outcome
Anybody that
of
hears
it.
of
Yeah.
anything that entails, going to the theater, their
Mm.
antennas are up. Yeah,
Yeah,
but
that's
it's a
true.
very, very safe,
Safe procedure.
procedure to
Okay.
have.
So
Yes.
yes, so this was the beginning of a fourth cycle. Would you say there's, I would let me ask if there's like a limit or something that you would amount of times you would discourage a person from repeating, IVF
IVF.
cycles or
No.
IVF treatments?
Okay.
There's none?
There's no limit
Oh, okay.
until they achieve their dreams.
Yeah.
That's what we always counsel. Even literature statistics show that success rate for IVF increases with each attempt.
Hmm.
Yeah, because each attempt, especially if it's in the same place, the doctor gets to understand the client better,
Yeah.
understand your body system better.
Mm-hmm.
Yes. So if they've not achieved their dream, we always encourage them to try again.
Okay.
Yeah, there are always new things to try. So we always encourage and counsel our clients to be open to the counsels we give them.
Mm-hmm.
Some people keep going through the cycle of failure because they're not ready and they're not open to taking counsel that we give them.
Something
Yes,
new.
so
Mm.
that is the reason for some failure. But if you've not achieved your, conception dreams or your dream of completing your family,
You
definitely
can
we
still try
encourage you to
again.
keep trying. Yes,
Okay.
there's no
Okay.
limit to the number of IVF
Oh,
treatments you can have.
okay. That's good to
Yes,
know.
yes,
So if you've struggled with, failed cycles over and over again, any sort of fertility treatment, I mean, IVF is not the only one. You can
yes.
always go back to your fertility specialist,
Yeah.
and you can also come to Abs Hospital. I mean, disclaimer, or should I say shameless promotion, just to know, see someone that can help you better, and ask questions as well. I would encourage you to do
Yeah.
that, right? If you're not open to, hearing something new or just learning a bit more, you might have a bit of reservation about it. But when you talk to your specialist and you ask questions and you're being informed about it, when you're informed, you're more comfortable about what you are about to do, right? You're
Yeah.
about to start. So I believe that will help you to even be more confident in what you're doing. Amara says, after this hysteroscope,
Stressful.
and then, starting the whole thing, she was even more relaxed, right? She
Okay.
did things
Yeah,
differently.
definitely.
She
She'll be
went
more
really,
relaxed because they
yeah.
found something that could
Mm-hmm.
have been causing. I'm sure her mind was even more at rest
Yeah.
because you're having an IVF treatment, you're failing, and they're not really telling you what
What
the failure
exactly
could be
is,
due
yeah.
to. You start to doubt yourself. You start to
Mm-hmm.
blame yourself.
It has
I'm
an
sure she started to feel that
emotional.
she was the problem, not only that there was a
Oh.
problem that was not,
Mm.
discovered. So I'm sure
Mm-hmm.
that gave her some relief that, oh, so there's a problem that
Yeah.
hasn't been discovered. Yeah. So I'm sure
There's-
she felt
mhm.
much more hopeful in this, fourth IVF treatment
Yeah.
she was going for.
I
Yeah.
mean, imagine how you would feel. It puts a lot of a mental load on
Yeah.
you, especially as
Because
a woman. I mean, in
yes.
our part of the world, I would say women have the brunt of the
Yeah.
whole
Women bear the
fertility
brunt.
process. Yeah,
Yes.
you bear
Yeah.
the brunt that, oh, if you're not having children, everybody thinks it's just,
The woman
you
the
know,
woman is the issue, is the
yeah.
problem.
And
Yeah.
then these might be things that, you're not even aware of, right? You don't have any idea about it because, I mean, if a woman has things like, these abnormalities in the uterus, a
Yeah.
polyp and scars, what are some things that she might see? I mean, do they
Okay.
always see signs
Yeah.
that there's
Depending
something?
on how loud they are, there might be
Mm,
signs and there might not be any. There might be symptoms and there might be none. For
mm,
example, if a woman has a submucous fibroid or even polyps, one of the things you could have is heavier menstrual flow, and
okay.
some even have intermenstrual bleeding after finishing your normal
Mm,
period. In between, they are
you're still
bleeding and
bleeding.
spotting again.
Okay.
That could be some of the telltale symptoms you
Mm,
could have, but a lot of women have them and might not really have those symptoms.
yeah.
Yeah.
So you may not actually really,
Yeah.
have something that you say is different about your
Mhm.
cycle, and then you now want to see the doctor about. So, just see a specialist, someone who is more knowledgeable about this, right? Someone who has been doing this over and over again, and then
Yeah.
there's success around it. That's why we want to do these Friday testimonials. We
Yeah,
want to
always
talk to you.
happening.
Yeah,
Yeah.
we want you to know that you're not the only one out there that is struggling
Yes.
with one thing or another. And we would like to, as much as possible, find the reason behind that to support you through that, because fertility journeys can be quite emotional, right?
No,
They
it
can be
is.
emotionally
Mm.
tasking.
Yeah.
You get tired, you get frustrated.
Mm.
I mean, 3 IVF cycles. How
Mm.
long, like in between, would you say? I mean, it can take years, right,
Yeah,
to
no,
have that.
yeah, it might not necessarily take years.
Hmm.
It depends on how soon she went back for another
For
one.
the cycle.
Yes,
Oh, okay.
yes,
But
yes.
I mean, it still does take quite an extended period of
Yeah.
time of
This was
your.
7 years she talked about of
Wow, yes,
waiting.
yes, of waiting. I
Yeah,
mean, you already have 7 years, you've
gone.
waited for
Mm.
this, and then you're trying something that you believed would be 100%, and then it's
Yeah,
not working. So,
yeah,
it's not your fault. I mean, you may have something that you're not even aware of. So you need to see someone about that. I mean, she was more reassured after having a more extensive evaluation and finding
Yes.
the root cause behind
Yeah.
these failed cycles. And she was calmer. When you're going through something, calmer. I mean, I've been told multiple times, when you're stressed, everything
Yeah,
is
that
just
affects the
mm-hmm.
process. Yeah, that's
So
anxiety, being
mm-hmm,
anxious, depression. A lot of our clients,
exactly.
all those things, because our emotions affect the
Mm.
hormonal milieu in our body. So those things do affect. When you are more hopeful, brighter, you're looking at the bright,
Yes,
it affects. So we
you
encourage, have a
be
positive attitude, be
mm-hmm,
hopeful, know that we're working with you, we want the best, you want it to succeed.
exactly.
Don't have this gloomy look about you, those things
Mm.
could affect. Yeah.
Exactly.
Mm.
So, when you're calmer, when you're more reassured, you have a brighter outlook towards
Yeah.
it, and then you're not condemning yourself to failure
Mm.
even
Yeah.
before you get anywhere. And she had to wait after all the procedures were done and her cycle was completed to take her test, which I'm sure she had been
The day of
she was,
pregnancy
yeah,
test.
she was nervous. I mean, that must be nerve-wracking considering you've seen so many negatives and you're
Yeah, I
just
can
like, oh
imagine.
my god,
Yes.
after this, am I still going to get this? In fact, after doing something even more extensive. But she did her test,
Okay.
and apparently she screamed, she cried, she laughed all at
Was
once
positive.
because she had a positive test results at pregnancy.
Great.
So you can imagine the joy that you feel.
Yeah.
There's
The joy is
just
not just for the clients, for
mm-hmm,
us too.
exactly. I
The
mean,
joy is
knowing
all
that when
round.
you've helped
Yeah.
someone
Joy is all
achieve,
round.
yeah, you've helped
It's a
someone to
very
also
good
achieve
feeling.
it.
Yeah.
Mhm. So I can just imagine how happy Amara must have felt. Like she was really excited about the
Mm.
whole procedure that she had done in Apso, and she's happy today. She's a proud mother, she said, of a baby boy. And every
Mm.
time she baby, she thinks about all those difficulties that she
Mm.
has and
To
all those
go through.
dark days and
Yeah.
how, you know, close she was to giving up because like I said, it can be
Mm.
very tasking from
Yeah.
what you've said, it can be
Yeah.
very tasking and you'd want to give up. But this process is not just for you, it's not just you alone to be. When you come to people that care about how your outlook is or what your outcome is, you have a better understanding and then you're calmer. And the extensive tests are encouraged, right? Extensive evaluation
Yeah.
is
Let the
encouraged
necessary
because
evaluations be done. Yeah.
exactly, she's happy about this laser hysteroscopy that she had
Mm.
because it didn't only how would I say work on those abnormalities within her uterus that was actually found. It just gave her that sense of hope. It
Mm.
restored her in
Yeah.
having a child, in being a mother, which is a dream for a lot of
Yeah.
women.
Yeah.
So yeah,
Mm.
congratulations, Amara.
Yeah, Amara,
Yeah.
we're very happy for you. And that's what we tell our women. Hope is not lost. As
Mm-hmm.
long as you're breathing, as long as
Yeah.
there's life, there's still hope. Don't give up.
As long
Don't
as
give up.
it's
You never know if that next attempt will
mm-hmm.
be where you get your dreams answered. Will be where your baby, you get to hold your baby from.
Yeah.
Yeah, so that's what we encourage and counsel our clients.
Mm-hmm.
Don't give up. Yeah, for IVF, for everybody, not everybody succeeds at the first attempt. That's our hope and that's what we pray, but that's not definitely what happens. But never give up. Thank
Never
God
give up.
Amara didn't give up.
Yeah.
At the end, she achieved,
Mm-hmm.
she achieved her dream, got her baby.
Yeah.
Yeah.
I mean, it's a moment of, joy. It's a moment of happiness where both yourself and your doctors have achieved that success. You have a weight kind of lifted off of your heart, your mind, and you're more stable when you have your baby in your hand. It's a powerful reminder that sometimes repeated failures is not the end, right? It's
Yeah.
a clue, as a matter of fact, that there might be something deeper.
Else we
Yeah,
have not looked at.
exactly.
Yeah.
Something else that you
Mm.
need to look at. So,
Yeah.
investigating those underlying issues can be very important through procedures like hysteroscopy. It can make all the difference in your IVF treatment, in your fertility journey. So right, we just want to tell you about this. Like I said, talking about something new. I mean, next
Mm.
time you go to see your fertility specialist,
Yeah,
if
when
you've
you
been
hear
struggling,
hysteroscopy, it won't be strange again.
exactly. And
Yeah.
if you would like to, even you can ask your doctor if you can
About
have this
it.
procedure done.
Yeah.
Like Dr. Debbie has said, it is a day procedure. It
Yeah.
is safe and it's
Yes.
minimally invasive. So you can have that done and even go back home the next day. And you never know, you might find that one clue or that one reason behind, those failures that you might have been experiencing. So thank you so much, Amara, for sending in your
Yeah.
story. Like we said, it is the beginning of something new. Your story isn't over. It's just this beginning of a new road to motherhood. Like you said, it wasn't easy, but I'm
Yeah.
so glad that you stuck
There's
with
light
it.
at the end of
Yes,
the tunnel.
there
And we just
is.
hope her story has encouraged a lot of our
Mm-hmm.
viewers this afternoon.
Yeah.
Yeah.
So
There's
thank
light
you.
at the end of the
Yeah.
tunnel.
Thank you
Yeah.
so much. It's your braveness,
Mm.
to share your story with us that
Mm.
also helps somebody out there.
Yeah.
When we have those testimonies,
Yeah.
it helps somebody out there that might have been struggling quietly or, just joins passively, and they're hearing something that they can relate to. So thank you so much for sending in your stories. And if you're struggling with this out there, you want to come see us at Alps Hospital. We have a branch in Jos and we have a branch in Abuja as well, so you can get your consultations. Even if you can't come in person, you can reach us
Have
online, right?
online
Yeah, you can have
consultations.
online
Yes.
consultations just so that you have more information about how your fertility journey might go and what you would like to have done, or what your doctor might want to do for you, just to make your just improve your chances of success. So stay hopeful, stay informed, and stay connected. Thank you
Yeah.
so much for staying with us until the end of this. Thank you so much, Dr. Debbie,
Thank you, Joanna.
for
Always, it's always a pleasure to be here. Thank you.
it is. Thanks to Dr. Debbie for telling us a bit more about this procedure that even if you had heard of and you were unsure of it, I hope this has, taught you a little bit more, and you're more comfortable going in for this procedure, or going in for something new with your fertility journey. So thank you so much for staying with us until the end of this live. We really appreciate having you here always. We have this done every Wednesdays and Fridays by 3 p.m. So make sure to join us. We have our social media platforms: YouTube, TikTok, Facebook, Instagram. You can join us every and anywhere. And make sure to turn on your notifications on all those apps, because you might forget, and that will help you to remember, so that you can have something new, you can learn something new, or you can have more encouragement, the next time that you have something that is weighing heavily on your mind. So thank you for joining us. We will see you next time. Have a lovely day. Bye.